Hello and welcome to another TMS Chats. Today I'm here with Sarah, and Sarah's just finished her 35 sessions with us, and yeah, she's been a bit excited with the results. Hey Sarah, maybe tell us a little bit about yourself.
Yes, sure. I'm 30 years old, and ever since I was 15 was when I was first diagnosed with depression and anxiety. So basically, half my life or more I've been on and off medications for that, so anxiety and depression, none with any real long-term benefits. I would normally go to the doctor to wean myself off because they weren't very effective, things like that. And more recently, so in the past 12 months, I was diagnosed with fibromyalgia and chronic pain, chronic migraines. So that's had a really big impact on my life, been really debilitating, made it hard to do a lot of things, get out of bed and do work.
Yes, and you've got a little one as well, haven't you?
Yeah, I got 4 kids in total.
Oh, 4?
Yeah, a lot to do.
You've got a lot going on.
Yeah.
What made you decide to give TMS a shot?
One of the many therapists I've been to over the years, I was talking in a session to her about how hard it was to get out of bed, find motivation to do things, along with the fact that I'd wake up every day in pain, and just how hard it was to go through life. And she actually said to give TMS a go because she herself had done it and found it really effective for like her focus and concentration. But she said that it would be really good to see if it helps with my depression, anxiety, motivation, but as a bonus I might also have some help with the pain management as well. Yeah, here we are.
Yeah, and you have seen some changes both in your mental health and the pain side, which
yes.
The pain side was a little unexpected.
Yeah, definitely. I was hoping that I might have some reduction in pain by coming here, but my main focus was the anxiety and depression. But what I've found is that, so I was on multiple medications daily just for pain management and the fibromyalgia, chronic pain, and I'd wake up every day in pain. But what I found is that halfway through my TMS sessions, the frequency and severity of my pain was dramatically reduced. I used to be in pain every day. Now I can go a couple of weeks without feeling the way I used to feel every minute of every day, basically. So that's been just so life-changing because it means I can get up, go to work and not feel so crappy, basically. So the pain side of it's been so remarkable on its own, but with that I've also had great improvement with like mental health. So anxiety and depression, not that it's cured and I'm never depressed or never anxious anymore, but if I have like low mood moments where I get a bit sad or start having a bit like of a panic about something, I'm not spiraling as much or for as long. I'm better able to stop in the moment and think to myself, rationalise a bit and pull myself up out of the dark space that you find yourself in sometimes. So my resilience, I think, has greatly improved.
You're getting that little pause button where you feel that you can take control and you're not
instead of everything's just, oh no, everything's fallen apart again and overwhelming and life's too much. You can stop really at the start of your spiral and be like, okay, we're not doing this, we're going to rise above.
Yeah, that's great.
Yeah, it's been really it's been so amazing.
The pain relief that's pretty impressive too.
Yeah, like I'm so stoked, like I've been telling all my family members about it because they were really worried about me for a period there as well. Yeah. And
you were having your TMS fairly frequently?
Yeah, so I decided to just go all in. So I was coming in 5 days a week so I could get it done as quickly as possible.
and you saw improvements?
Yeah. Even in the first week you notice like a bit of a shift, but you do a score sheet on your 10th session and you compare it to your initial score sheet, and my scores for anxiety and depression and stress were halved just by the 10th session, and that's not even me factoring in how was my pain reduction, but just the mental health aspect the scores were halved, which was
very encouraging.
Yeah, to see it on paper like that, you're like, wow. Yeah. That's right. Yeah.
Well, that's good. So I'm taking that your overall take on TMS therapy is fairly positive.
Yeah, I've actually told quite a few family members about it who do have like anxiety and stuff. I'm telling them to give it a go as well, and I think everyone's just really like happy for me that I can come off these medications now that were for my pain, and even maybe look at down the road coming off my like antidepressants as well. It'd be nice to not have to rely so much on medicine to get by.
There's another avenue that you've got in your treatment.
Yeah, that's right.
Which can give you some confidence to go forward.
Yes, yeah, definitely.
Oh, look, Sarah, that's terrific.
Thank you.
And thank you. You've been a lovely patient for us.
Oh, thanks so much.
Client, she's a client.
It's been great to see you guys every day, every week.
Yeah, we get a little attached, don't we?
Yeah, I'm going to miss you.
All right, well, we wish you all the very best.
Thank you.
We'll see you in a few months when you come back for some maintenance.
Yes, sounds good.
All right, thank you.
Thanks.